Hi, everyone. I'm Stephanie Shen, Vice President for Product Category Management for the North America Distribution Group, managing products and supplier relations to support the U.S. commercial businesses. We are responsible for maintaining all of the items within our systems, making sure that the product data is robust and accurate, and also vetting new products and new suppliers, and working with our internal partners to determine the commercialization strategies for our key product categories. We carry over 120,000 stocking items in our core warehouses around the country and have access to over 100,000 items on a non-stock basis, all with the goal of supporting our customers in the healthcare industry. The COVID-19 pandemic continues to have significant impact for Henry Schein, the global community, and society at large. We quickly saw that demand on traditional categories like PPE, personal protective equipment, shoot through the roof. The demand within these traditional categories typically were very minimal, and we struggled to meet the growing demand as the virus developed around the world. In addition to these demand surges, the regulatory landscape was constantly evolving, and it still is as we struggle to understand how the virus behaves. So as a product category management team, we really strive to understand all of the changing market dynamics, including meeting with our suppliers to understand their manufacturing capabilities, as well as working with our sales teams to stay closely connected with our customers to understand their clinical needs. We put together a task force made up of leaders from areas of marketing, product, supply chain, regulatory, and sourcing. We use this task force to share information and best practices, and more importantly, understand how the virus was developing. This task force during that time also vetted over 1,000 new opportunities on products and suppliers to ensure that we always had product alternatives when there was a gap in our supply chain. We also worked very closely with our existing suppliers to ensure that we understood their manufacturing capabilities as the demand for COVID-related products surged. In addition to all of this, we worked and invested heavily in our systems to make sure that we have the proper inventory allocation systems to manage our restriction and rationing process so that we could preserve supply when needed and ensure that products and priority customers, such as first responders and frontline providers, received the products that they needed to provide care. Every supplier in the Henry Schein portfolio has to go through an extensive process in order to be an approved supplier within our system. In addition, as an organization, Henry Schein itself ensures that all Team Schein members adheres to our worldwide business ethics and operates with our Team Schein values, which lays the foundational standards for us as an organization on our core values of integrity and honesty. These core values are embedded in everything that each Team Schein member does every single day. We pride ourselves in aligning ourselves with suppliers who meet our core values and align to our standards of operations. And I think it's no coincidence that Henry Schein, for 11 years in a row, has been named to Ethisphere's most ethical company in the healthcare sector, including 2022. We operate by the simple operating standards of doing well by doing good. What that means for us is that we make sure our business processes are aligned with our stakeholders to ensure that we succeed in our business overall in providing positive and impactful outcomes for the world at large. But specifically, Henry Schein has a history of being an active participant in many government initiatives around the world and making sure that health is a priority. For example, we are one of the co-founders for the pandemic supply chain, acting as the private sector lead in partnership with the World Economic Forum, the World Health, and the World Bank. In addition, we participate in a number of activities from the U.S. Health and Human Services on their pandemic relief programs that are managed by either FEMA or the Strategic National Stockpile. These are just some examples of our involvement with the public sector as we advance health around the world. My advice to any organization at the beginning of their environmental sustainability journey is to take a good look internally and understand your organization's structure and resources as it relates to environmental impact. This would include having an overall assessment of the accountability and responsibilities within the organizational structure and ensure that it's aligned to business priorities and especially financial budgets. It's important to understand where you are as an organization and set metrics and targets with realistic timelines that are aligned to resources that are available. That way, you have a step-by-step approach to figure out what are the meaningful metrics and reporting needed in order for your organization to advance an effective environmental sustainable program.